When patients either have no teeth or their remaining teeth are failing, they're often great candidates for full arch dental implant treatment. And by this we mean where we use anywhere from 4 to 6 or even more implants to replace a full complement of teeth. The way this generally starts is with getting to know each other. We find that one of the most important things in the success of the treatment is chemistry between us and our patients. Then we like to make sure we get all the medical information. And then we obtain a lot of records, radiographs, impressions, scans, and we design our treatment from there. We don't do one size fits all. And from this, we try to determine what risk factors you have so that we maximize our chances for success, both in terms of the longevity of the implants and the prosthetics, as well as the aesthetic outcome. When we're talking about not taking a one-size-fits-all approach or having a custom approach, things that we like to look for are patient's age. When we remove all of somebody's teeth, that is something they're going to have to live with for the rest of their life. And oftentimes we meet patients here who have teeth that are salvageable and can be useful for the patient for many years, if not decades. There's also various medical conditions and medications that can place one at much greater risk for implant failure, as well as complications following the surgery. These patients may not be ideal candidates for teeth in a day or full arch implant treatment. And then finally, after getting to know patients, some patients may do very well with just complete dentures or lock-in, lock-out type of dentures. Dental implant surgery, by its nature, is atraumatic. For the implants to be as successful as they are, the surgeries have to be performed in an atraumatic manner. And as a result, most patients experience very minimal amounts of pain. Some patients experience more pain than we would have expected, and for them, we can alter our pain management protocol. But most patients are sleeping at night, they're having a modified diet, they're able to work and perform most activities of daily living without too much problem. It never gets easier to replace a missing tooth the longer time goes on. As time goes on, bone typically shrinks, adjacent teeth may move, the cost of treatment, the duration of treatment, and the outcome of the treatment is oftentimes compromised. If you're missing teeth, if you're about to be missing teeth, if your dentures don't fit, if you'd like to know more about dental implants, please give us a call. We'd love to meet you and walk you through the process.